we'll give it one more minute. Once we hit 5 o'clock or 7 o'clock on the dot your time, I'm going to get started on the webinar. So you have to bear with me a little bit today. I actually came down with COVID on Sunday, and I've been okay. I'm not like coffee or anything like that, but definitely it hits me really hard in the early evening. So I've managed to pull myself together so I can do this webinar tonight. So if I seem a little out of it here and there, it should be good, but just note that I am in the midst of it. So I appreciate any patience you may give me with this. So I'm going to get started. And today's conversation is the importance of vaginal health. And I want to thank VitaHealth for having me today and giving me the opportunity to speak to their consumers. And I also want to thank them for carrying the Aeryon Wellness products. So who am I? Let's go to the next slide. Oh, here we go. Sorry about that. So who am I? My name is Erin Ashley. I'm the founder and CEO of Aeryon Wellness Support Supplements. I'm a certified holistic nutritionalist, a registered holistic nutritionalist, ISSA trainer, eating disorder recovery coach, and a CBT practitioner as well, cognitive behavioral therapist practitioner. In 2020 and 2021, I was voted as top 100 health and wellness influencer. I have a #1 book on Amazon called Bulimia to Balance. I have 4 cookbooks with my daughter, Michaela, and for a number of years, I had a radio segment out here, a wellness radio segment. So a little bit about my history. I struggled with eating disorders for about 25 years. I went into competitive fitness, and which to me was more of a glorified eating disorder. That was from my experience for it. And I had my aha moment about 10 years ago in which my daughter almost caught me in the midst of a purge. And in that moment, when I caught my reflection, I realized that if I didn't change my story, if I didn't make different choices, that this could be my daughter's path, that the destructive relationship with my body and food and exercise could ultimately be hers. And that really was the catalyst to change my life. And so I really began embodying, looking at a whole, what being holistically well was. So I worked with therapists for cognitive behavioral therapy. I worked on nutrition. I worked with movement. And then I began looking also my support network as well. And then I began looking at supplementation. At the time, there was nothing really on the market that I found that spoke to me or that really resonated with the message that I believed, that it's not just supplementation. It's not just movement. It's not just nutrition. It's all these things together. And that's really how Aeryon Wellness was born, and how we now use the QR code technology on the front of every label to give meal plans and education and tips and strategies to support our consumers on their journey. So the 5 pillars of holistic health with Aeryon Wellness are the thoughts you think, the friends you keep, daily movement, nutrition, and then supplementation. So it's really a matter of looking at all of these together. And I'm going to try to use these as we web and weave through today's conversation, because it's not just one thing, but a really accumulation of the whole to find sustainable health and wellness. So today's conversation is vagina. And love this word. And I think we need to empower women to say this word more often and to create more of a normal conversation of the word vagina. So today's conversation word of the day is vagina. So here's some myth busting. So vaginas should always be fruity and smell pleasant. So I think we all know that this is a fiction, right? Vaginal discharge should always unhealthy. That is not true. You should clean your vagina with douches and other cleansers. You know, the vagina is actually a self-cleaning organ. So no, we don't need to do that. Eating pineapple will make your vagina sweeter. Up to about 5-6 years ago, I actually believed that too. It does not. And the more sex you have, the looser the vagina becomes. That is not true as well. The muscles can relax a little, but that does not mean that you're going to have a looser vagina. And the muscles can relax with childbirth more so. And the vagina is complicated, confusing, and tricky to navigate. And I'm hoping today in my conversation that I can at least shed some more light to not make it confusing or complicated or tricky if that's something that you're experiencing right now. So the topics for discussion today, we're going to be doing vaginal health, meet the vagina, vaginal immunity, mucous barrier, vaginal flora, vaginal pH, unbalanced vaginal pH, factors, solutions, supplements, and Q&A in the end. So if you have any questions, please keep them for the end, and I'll be more than happy to answer them. It just makes it a little easier so I can stay focused and on track. So what is vaginal health? So vaginal health, as we know, is an important part of our women's overall health, or those with a vagina. It's an important part of their overall health. And vaginal problems can affect fertility, but they also can affect the desire for sex and our ability to reach orgasm. And ongoing vaginal issues, and I've had my own personal ongoing vaginal issues, can cause stress on relationships and affect self-confidence. And I think if you've ever had an experience with bacterial vaginosis or a yeast infection, I think you can all resonate with that one. So let's meet our vagina. So the external female genitalia, so the vulva, and a lot of people don't know this, but the vulva is the lady parts between your legs, visible from the outside. So the vulva is the outside female genitalia. The clitoris is for pleasure. Hopefully we've all had an opportunity to enjoy that. The labia is the outer and inner folds. So we have the labia majora, which is the outside, and the labia minora, which is more the inside skin folds. Then we have the urethra, where the urine exits, and then we have the vagina, the wonderful, glorious vagina, where we get our period, discharge, and our babies come from. So then we have the internal female genitalia, and it's composed of an upper and lower reproductive tract. So this includes, the upper tract includes the fallopian tubes, the uterus, and the endocervix. And then the lower reproductive tract includes the ectocervix and also the vaginal tract. So it's a really complex ecosystem, and this houses our immune cells, hormones, and also microorganisms, and they all interact together. So we're going to touch base on immune health. And I think a lot of the time when we think of immunity, we think of colds or flu, or somebody like myself experiencing COVID right now. You think about your immune health, you think about more of that. So we're going to go over the two different types of immunity that we have, right? So the major ones. So innate immunity is what we're born with, right? Our skin protection, also physical barriers, right? So our skin is a big part of our innate immunity. It protects us. Then adaptive immunity is when we've had a vaccine, let's say, for example, or if we've created antibodies from getting sick from having a cold, so we've created those naturally. So that's adaptive immunity. So there's two types of immunity that we're going to be looking at. But for the vaginal area, we're going to be looking at the innate vaginal immune system. That's what we're going to be looking at tonight. And that is the first line of defense against foreign organisms and pathogens and microbes. So when these major components, the ones we're going to be talking about in the next several slides, are natural, the balance isn't maintained, then disease can be averted, right? So we don't have some of those issues that can become prevalent if we don't have that imbalance, right? So we have the skin, the mucous membranes, secretion of skin, and the mucous membranes as well. So we're going to be going the first line of defense is what we're really going to be looking at today. So one of the big ones is mucosa. So mucosa actually is a moist lining that lines some of the organs and body cavities within our bodies all over, and is composed of, I have trouble with this word sometimes, epithelium cells, there we go, and connective tissues. In the female genitalia tract we talked about before, the mucosa is a really critical, important site for the immune defense against microbes, so against those pathogens, those unwanted bacteria we don't want in there. So this tissue maintains a delicate balance between not only protecting against external pathogens, but it also really wants to provide optimum conditions for reproduction. So the mucosa is a very important lining that we have within our vaginal cavity. The next we have the cervical mucus. So this lines the cervix, the vagina, the vulva, and this creates a protective barrier against the body and the environment, right? So really looking at that innate immunity. And if you look at this slide here, that is actually cervical mucus underneath a microscope. And how beautiful is that? I mean, I find it quite pretty. I almost think that would be a really pretty wallpaper. Like it's very beautiful. So it kind of changes your perception or what you think cervical mucus really looks like. So that's quite gorgeous, I think, personally. And this plays a major role in protecting against pathogens. It also helps the sperm reach the reproductive tract, and it signals for disease if there's pregnancy issues as well. But it also fosters healthy vaginal flora. And that brings us to our next part of our immunity. So the vaginal flora. So the vaginal microbiome or vaginal flora, it's kind of a fancy way of describing it. It's millions of bacteria that live in our vagina. And sometimes we think bacteria is a bad thing, but if you're familiar with gut bacteria, then you know that actually there's plenty of good bacteria that we need to have in our body to ward off any infections. So the role of the vaginal microbiome is to shield against microbes, produce antimicrobial substances, stimulates the immune system as well, which is important, protects the integrity of the mucosas. We talked about that. It also favors the secretion of mucus. So we talked about cervical mucus, and it also maintains a protective acidic pH. And we're going to talk a little bit about that in a couple slides. So vaginal eubiosis is characterized when things are in balance, when the lactobacilli, so that's the dominant bacteria in the vagina, right? So we have 99% of lactobacilli, and it secretes lactic acid and hydrogen peroxide, and that's what gives the vagina the pH acidic level that it needs to also protect against pathogens. Vaginal dysbiosis, kind of very similar to gut dysbiosis when your bacteria is off. It means that you're not predominantly lactobacilli. And then what ends up happening is that can also cause an overgrowth of multiple anaerobes. So it can cause an imbalance, and that imbalance can then cause pathogens then to come into the vaginal area. Hold on, I need to get a sip of tea here. 1 second. There we go. An example of vaginal dysbiosis would be bacterial vaginosis, also yeast infections as well. So a normal, healthy vaginal ecosystem, and it's really amazing if you think of our bodies and how they all of these little things are just ongoing and working when we're just kind of functioning in our day-to-day. But the vaginal ecosystem is maintained by lactobacilli, and that secretes lactic acid and hydrogen peroxide, which is responsible for keeping our vaginal pH under 4.5, which we're going to talk about why that's important. But if you look at here, and estrogen is a big part to do with that as well. So we have estrogen in there, lactobacilli, and that's going to secrete the lactic acid. It keeps the pH going. You got the glycogen in there, and that promotes further growth of lactobacilli, and that then protects against pathogenic bacteria. So this whole microcosm is really, really important. So what is pH? So if you're not familiar with pH, a lot of the time we know we have acid and alkaline, and what we're told is a lot of disease can't thrive in an acidic environment, right? So we want to be more alkaline. We're always taught we want to be more alkaline. Or as the disease, thrives in an acidic environment. So we want to be more alkaline. Sorry about that. But in this case, we actually want to be more acidic in our vagina, right? So when we look here, a healthy vaginal pH would be, as I talked about before, between 4 and 4.5. So it's quite acidic. And yeah, as I said, so between a 4 and a 4.5. So the more acidic the vagina is, it protects the vaginal mucosa against pathogenic organisms, right? So it's really important that we keep our pH levels quite acidic down there. And one thing I've always found interesting is, why are my knickers bleached? And I think a lot of the time we can look at our underwear and be like, what is happening? We want it to be that way because the hydrogen peroxide. So we're bleaching it. So we're so acidic that it's actually bleaching the color of our underwear, which is actually, believe it or not, a good thing. It means you're actually quite acidic. So that's a really good thing to have that happen. Now, an unbalanced pH, what happens when it's unbalanced, can lead to yeast infections, including can lead to yeast infections or bacterial vaginosis. And 75% of women are going to experience one yeast infection in their lifetime. And with bacterial vaginosis, it's the most common vaginal issue that women go into doctors for. And 1 out of 3 will experience bacterial vaginosis. Myself, I had a partner who was not, I guess you'd say, on the up and up. We were together for a number of years, and I found it after he had been sleeping around, after we'd broken up, and I experienced bacterial vaginosis. And I had a really hard time getting rid of it. And I kept going on antibiotics, and antibiotics until I finally ended up using our product that we have now, Up and Away. And that made all the difference in the world. So I'll talk a little bit about that in a second. But it is something that is the most frustrating thing in the world to have something like that happen. So what is the difference between yeast infections and bacterial vaginosis? So they're very similar, but they're actually very different. So with bacterial vaginosis, you don't get itchy yeast infections, you do. Bacterial vaginosis, you know right away the smell is really off and there's no odor with yeast or candida. With bacterial vaginosis, it's a thin gray white discharge. With yeast, it's more of a cottage cheesy discharge. Bacterial vaginosis, there's no soreness, yeast infection, soreness. And bacterial vaginosis is caused by bacteria. Yeast infections are caused by yeast. Now, some of the factors to why yeast infections can happen is antibiotic use. So this can kill your healthy bacteria. So we really want to make sure if you are taking antibiotics that you're taking a really good probiotic, make sure not at the same time when you're taking antibiotics, but make sure you get a really high dose probiotic to be taking. We're going to be launching a probiotic eventually down the road with Aeryon Wellness, but make sure you get a really great one. There's a lot that are about 100 to 130, I think they are, billion. I'm a big advocate for probiotics as well. Another reason you can get yeast infections if you are experiencing them on a regular basis is estrogen. So what we find is women who are menopausal, because of course your estrogen levels are dropping. We know that estrogen is also responsible for our vaginal microbiome, that they can have more yeast infections and also more bacterial vaginosis. And so that's something to really look at too. And if you have high levels, it can cause candida overgrowth. So really important that we find that estrogen balance. And then there's douching as well. Douching can upset natural balance. We want to make sure that we're not using those scented, as I said before, your vagina is a self-cleaning organ. You don't need to be using scented douches and whatnot. You can use water, that works just fine. Sugar, if you're finding you're having chronic yeast infections, yeast feeds off sugar. So really lowering your sugar levels as well, making sure you're kind of paying a little more attention to that. For bacterial vaginosis, some of the things that we need to look at is excess exposure to psychosocial stress can actually cause a prevalence to bacterial vaginosis, and also sex. So one of the things I've read when I've looked at bacterial vaginosis, what I found very interesting is that they state they can come from numerous partners, which is not really necessarily the case. Male sperm is very alkaline. We are, as I've shared in these slides, very acidic. So when we come together and if we're having unprotected sex, what our bodies do, because we're amazing magical beings, is our bodies instantly try to become more alkaline to protect the sperm so we can get pregnant. That's what our body is like, oh, this is our job, this is what we're supposed to do. And so what has a problem afterwards is getting back down to that acidic level. So it doesn't necessarily mean you have to have numerous partners. It can just be one partner, right? And so I think if you have had different partners in your lifetime, some of you may resonate with the fact maybe one of your partners you just found, holy smokes, I keep getting bacterial vaginosis. And what it could be is he is very, very alkaline, and you're having a hard time getting back down to that acidic level. Sex toys are another thing. They're reused and they're not cleaned properly. So make sure that you're cleaning those properly. And then always remembering excuse me, to wipe front to back. That's another big one as well. And that's also a recommendation for anybody struggling with urinary tract infections too. So I'm going to take another drink. Okay, so some of the solutions. Now I spoke a little about a product that I have from, some of the solutions. So I'm going to talk about them in a bit. Sorry about that. So some of the solutions, the big one is looking at your microbiome and your digestive health. So all disease begins the gut. 80% of the immune system is in the gut. It's called the second brain for a reason. We want to make sure that we're absorbing our nutrients, and that's going to help us make hormones and also eliminate the ones that we don't need. When we look at genetically, 90% were similar. That's the studies have shown. However, we're only 10% similar when it comes to our microbiome. So it shows what a difference we are individually. And so it's really important, we're outnumbered by bacteria to human cells 10 to 1. So it's so important that we're supporting our good bacteria in our gut and all over our body to make sure that it can help us in living a healthier life. So poor gut health can lead to estrogen dominance. I talked about that, how estrogen can play a role in yeast infections. And so what happens is digestion and elimination is one of the ways your body can get rid of estrogen in your body, and your estrogen metabolize estrogen. And so if that is not functioning, that's an important thing we need to make sure we're taking care of. Digestive issues such as gas, bloating, constipation, it can cause PMS, brain fog, higher risk of breast cancer, and harmful estrogen metabolites because your body's not getting rid of that estrogen, it's just recycling in your body, and mood imbalances, to name a few. So supporting gut and vaginal health, we want to make sure we're feeding our body fiber-rich foods and a variety of micronutrients, fermented foods such as sauerkraut, kimchi, all those great things. Bone broth is another great one. Supplements that you can use would be glutamine, really helps gut health as well, zinc, omega-3s, and NAC. And then if you're addressing issues of bacterial overgrowth, look at GI map testing, SIBO breath tests, and you can do H. pylori screening as well. And you can also look at if you're having issues with gut health or gut dysbiosis, sorry, you can look at eliminating inflammatory foods from your diet. So food that you're sensitive to can be highly processed foods and oil, and looking at maybe a 21-day elimination diet. Using digestive enzymes, making sure you chew our food well. I think a lot of us, myself included, I can look back at a meal and be like, did I even taste it? Prokinetics, and then also reducing stress as well. Prokinetics are bitters too. You can use those as well. And then support your microbiome diversity with probiotics, fermented food, avoiding pesticides, and having a diversity of produce. So don't just eat the same thing all the time, but really give your body different produce. So a high quality probiotic is also, as I talked about earlier, another great resource. And eating probiotic rich foods. You want to give your good bugs the food they need to eat, right? So that's rotating rotating your produce, eating good quality protein. If you're not into animal protein, then find yourself a really good vegan protein, or make sure that you're taking in some really great proteins. And support your intestinal lining integrity with bone broth or NAC or apples and prebiotics. Excuse me. And supporting the motility with ginger and prokinetics, as I said, with the bitters. And then supporting absorption and digestion with digestive enzymes and HCl. And I kind of repeated myself on a couple of those slides, but I just want to really kind of resonate with the fact that we need to look at supporting ourselves gut health wise too. And so that was all interconnected, because when we look at our overall health, our immune health, our vaginal health, our sexual health, it's all health. And all of this is so interconnected. So we need to make sure we're giving our body the supportive nutrients it needs to be able to give us the results we technically want, right? So now we're going to look at some of the supplements that are available. And as I had mentioned, when I was struggling with chronic bacterial vaginosis, I went to my doctor. I had 3 to 4 rounds of antibiotics over and over and over again. Finally, I booked an appointment with a female gynecologist, and I went in, and boric acid was the product that she suggested for me, and it was gone like that. So Aeryon Wellness is the first and only company in Canada to sell and actually I think North America, to be quite honest with you, to sell a boric acid, 100% boric acid vaginal suppository. And so we also just won 2 weekends ago Launchpad Innovative Product of the Year at CHFA, which is the Canadian Food and Health Association, at the awards. So we're really excited about that. So what boric acid is, it possesses antiviral, antibacterial, antifungal properties. These are just pills. They're a suppository you put in the applicator. Put it 3/4 up your vagina, put it in, and you're done. It helps improve symptoms such as burning, itching, abnormal discharge, and odor. And to be honest with you, we have on the side of the box, it can be used up to 14 days. I've only used it once or twice. I find after I get my period, because blood is alkaline, I can notice it's a little off. I'll put one up, fine the next day, right? So it's really great that way. So what is boric acid? So what you get in the kit is you get 100% boric acid in a veggie capsule. We've chosen veggie capsule over gelatin. Most of them are made in gelatin, and it's 100% boric acid. So as I said, you just place the pill in the applicator, insert into the vagina, and go to bed, and ta-da, you can use a panty liner if you like. Makes all the difference in the world. And I wish I would have discovered this opposed to being on 3 to 4 rounds of probiotics. Of antibiotics. Sorry about that. So the next one we're going to talk about is, we have the pH testing strips too. So if you wanted to check where you're at, on the side of the pH testing strip, I should have grabbed one. Hold on, I'm going to grab one. Sorry about that. I'm not thinking my best. Okay, so on the side of here, we have a little testing. So you basically just take the strip out. You take a little Q-tip. I'll open it up and show you. I have one that's open. Hold on. Should I have this organized? I do apologize. Okay, so you basically, they're little strips. right? So really nice and easy to use. So you basically take a Q-tip, you take some vaginal juice, put on the end, and then you match it up with the color code on the side. You want to stay more in the yellow consistency. Obviously you're hitting green. That means you're more alkaline. So your mouth tends to be more alkaline. So I'll give you an example. So when we look here, if you can see that, there we go. It's more green, right? So that's more alkaline. You do not want your vagina this color. So note to self. A little side funny story. My daughter, who's 13, she does have her period now. So she went to, not now, but she has her, has her period on a regular basis. Anyway, so she went to try these and she's like, Mom, they don't work at all. And she goes, they didn't change color. I'm like, well, that's a good thing, babe. That means your pH levels are really on target. So, and so what they usually say with these, and we do have these on the website that kind of go over it, but when you're below, when you hit a 5 is more bacterial vaginosis, 4.5 to 5 would be more of a yeast infection. Now, usually you can tell, as most women know, when it's a yeast infection or bacterial vaginosis, but these are a great little way to test if you want to check and see where you're at that day. The next thing I'm going to talk about for a second is Reclaim. Reclaim is our hormonal support product. I know I shouldn't have favorite products within the brand, but this is my superstar child. I love this product. I'm perimenopause. It's made all the difference in the world for cycle regularity and for mood. But for Reclaim, we talked about how estrogen dominance can lead also to yeast infections on a regular basis. So really supporting and making sure that your estrogen metabolism is working effectively and you're getting rid of that excess estrogen in your system. So this supports healthy estrogen detoxification, mood stability, detox, and also help your body with cycle regularity, immune support, and liver support. I'll go over this quickly. Calcium diglucarate is for stage 2 liver detoxification. So it supports the liver in its job of expelling the excess estrogen in your system. We have green tea extract in there, support your liver health and also helps with blood sugar regulation. We have broccoli sulforaphane, which is antioxidant, antimicrobial, anti-aging. We have DIM in there as well that helps balance the good estrogen to bad estrogen. We have St. John's wort in here. And so St. John's wort clinical dose 4 to 1. So you actually feel it when you take it in about 15 minutes. White yam, which helps with testosterone and DHEA production. And then we also have added B6, and then we have astragalus and zinc for immune health. So really the most comprehensive hormonal support, support product on the market. It's all clinical doses as well. And then for stress, because when we looked at bacterial vaginosis, if you're experiencing psychosocial stress, of course, stress, you can hook yourself up to all the ashwagandha in the world. But if you're in a a fear-based, self-depreciating state, it's not going to help. You really have to looking at ways you can de-stress yourself. So I welcome you to visit our website. We have different suggestions for just de-stressing, but if you are looking for a stress support product, this is a great one. It helps with adrenal health, boosts cognition, helps mood, and also helps with hormonal harmony. I'll go over this one quick. We have Chinese hawthorn. There's a 2018 study on stress-induced depression. So the Chinese hawthorn's in there. We have the KSM 66 ashwagandha, which is the most award-winning ashwagandha on the market today. And that comes from the root. That's what you really want to make sure you're getting, the root of the ashwagandha, because that's where the withanolthols are. And there's 5% withanolthols in there. We have bacopa in there for focus and clarity, so no energy dips in the afternoon. Astragalus as well to help with not only stress, but also help with immune support. Shishandra to turn down the overproduction of cortisol, which is that stress hormone, and then B5 as well. With all of our products, I recently, in December, I was on Dragon's Den, and I had 3 offers and 1 accepted one with Arlene. So if you'd like to watch that episode, I welcome you just to type in Aeryon Wellness Dragon's Den. You can watch it. But how I got on the show was the use of our QR codes. As I stated in the beginning of the webinar, I don't believe there's just one thing necessarily for holistic health or to find yourself and to sustainable health and wellness. And so every single product has its own individualized meal plan. We also have tons of information and education in these QR codes, plus a video explaining the product, because I really want to empower my consumers and also my retailer friends to support their consumers on their journey to health and wellness. And so, as I said, it's not just one facet, but it's really those 5 pillars I talked about earlier. So if you find our products, scan a QR code, take a look at the plans. If you love them, let us know. That's really nice. But we do have those on every single bottle. And I don't know if there's any questions. I don't know if anybody had any questions. if there's any questions, I can answer anything if there are any questions. The last conversation, the last talk I did last week, we had a lot of conversations and questions about vaginal dryness. So I will kind of just give a couple tidbits. If you do experience vaginal dryness, some of the things you can look at taking is vitamin D, vitamin E, fish oils, hyaluronic acid is a great one too. Because we all know that this is really a result of a decrease in estrogen. When women hit menopause, of course, our estrogen levels are lowered. And so that's something you can look at. Same with vaginal atrophy. There's a lot of women on our last call who are experiencing painful sex with their partners. So really looking at some phytoestrogen foods would be a great resource. Some soybeans, making sure you're having those flax seeds. And a big one too is water, believe it or not, for not only vaginal dryness, but also for vaginal atrophy, making sure you drink lots of water and limiting your coffee as well. We will have a menopause product we're launching in 2023. And with that, we're also going to be launching a lubricant as well. So I'm really excited about those two. And we're also right now looking at creating a product for vaginal atrophy. So you'll have to stay tuned for that one. And if there aren't any questions, I welcome you to follow us on our newsletter. We do webinars every single month. Our next one we have is going to be talking about how to manage your cycles, 4 different cycles of a woman's month, and how to make sure that you can balance your life, kind of like biohacking your cycles. So that one's coming up on May 17th. I welcome you to join us. So subscribe to our newsletter and you'll be alerted of those. We also have a section called The Friends You Keep. So we do monthly interviews with women doing exceptional things. So it's not just a newsletter sending you product information. We really try to enrich your life and enhance what your life is. Follow us on Instagram or Twitter at Aeryon Wellness, Facebook Aeryon Wellness, YouTube Aeryon Wellness. And if you'd like to follow me, it's Aeryon Bella Ashley is my personal IG, Instagram. So on that note, thank you so much for your time tonight. And as I said, if you have any questions, you can feel free to contact me directly on Instagram. And that's about it. So thank you so much for this evening. Take care.